Hi there! Today I would like to talk about stress and diabetes. You would almost think that the word stress and diabetes are synonyms at times. It's actually a very big concern of diabetics to have too much stress, and having a chronic disease like diabetes causes extra stress on top of your already busy and stressful life. So today I want to talk to you about ways to manage stress. In a previous video I talked about a pastime and finding something that you enjoy that can take your mind off of diabetes. But there are other things that you can do. The reason that stress is such a big deal for diabetics is because cortisol, the hormone that is released when you're under a lot of stress, actually raises your blood sugar. Here in my classroom, on days like today, I can tell that my cortisol level is raised a lot. And so it takes my breath away sometimes. I actually find myself breathing really shallow, and my heart is beating fast, and my adrenaline is rushing at times to try to keep up with the pace of the students and the high demands of teaching. And so as a diabetic, I need to be careful of that, and it's hard to calculate insulin according to the cortisol level that's in your blood, and yet it causes your blood sugar to be raised for hours at a time if you have high levels of stress, which I can vouch for. So one thing that you can do is breathing. Breathing is really important for diabetics when you get to that point when you feel like you're breathing shallow and your stress level is going up, so it's sending that cortisol into your bloodstream. So taking deep breaths, I'll go through the steps with you right now, and then we'll talk about a couple more things. So stop what you're doing, lie or sit down and in a comfortable position, and put your hand on your stomach or just below your navel, and I want you to take a deep breath in with your eyes closed. Ready? And then I want you to count to 10 while you breathe out. Breathe in again. Breathe out. And as you breathe in, I want you to feel the rise, and out, I want you to feel the fall of your stomach, and notice the rhythm of your breathing. And I want you to count at least to 8 if you can't make it to 10. And then breathe out 6. And I want you to repeat this about 10 times and see how you feel. If you need to breathe for a little longer after that, I understand. Okay, thank you for breathing with me. The next thing I want to talk about is exercise. Exercise is a great stress reliever for most people, and if you find that exercising is hard for you, walking is pretty simple for most people. It's not strenuous, but it sure affects your blood sugar and your stress level. So take a walk, even if it's not a brisk walk, just take a walk and notice the trees and the flowers and the sunshine, and take big deep breaths while you're out there taking a walk as well. And another thing is get a nice big drink of water to keep yourself hydrated, because stress and diabetes is real. People might say, well, you can control it and you should be just fine, but it actually, after years and years and years of dealing with blood sugars every single day, every single minute of every single hour, it gets on your list of stressors. And so to minimize it, please try some deep breathing, try some walks. The last thing I wanted to mention is just sitting down and thinking, which is also called meditation. Meditation is a huge stress reliever, and you need to find one. There are a lot of videos on YouTube for stress relief meditation, and just listen to one of those that you like and you find that you are comfortable with, and sit down and meditate. So the top 3 things are breathing, exercise or walking, and meditation. Have a stress-free day.